What is Peyronie's disease? My name's Kristen Graham. I'm a physician assistant and I specialize in men's health. Peyronie's disease is a connective tissue disorder that is scar tissue inside the penis. So you may have seen some commercials that talk about curvature with erections, and that's what this is.
A bend with a bump in your erection might be painful, embarrassing, difficult to talk about, and could be Peyronie's disease or PD.
It's usually linked to some type of injury, but for most guys, it's more of a micro injury. It's not like every guy who develops Peyronie's disease has this traumatic experience during sex where you have a penile fracture or something, although that does exist too. But typically these micro injuries lead to scar tissue formation inside the penis. Genetically, some people can be more prone to the scar tissue formation as well. Other risk factors that can lead to this are age, mainly for the reason that your erections do change with age. And so if you're noticing any weakening of the erections, it's ideal to have that treated to try to prevent some of these injuries too. I usually tell guys, if you're having weakening of the erections, it can put things at risk for getting jammed up with penetration. You can create this injury and then scar tissue formation from there. There's a lot of different presentations of Peyronie's disease, but the most bothersome symptom tends to be curvature with erections. It can also be linked to painful erections, loss of length, indentation or hourglass shape of the erection. And generally what you'll see then is that you might notice a lump or bump in the penis, but you typically can feel this while flaccid. And then the symptoms of Peyronie's disease you see with an erection. You go through an active phase of scar tissue formation, so you can have changes of your symptoms in this period of time. The curve can get better or get worse, can stay the same for some guys. If you do have painful erections, this will dissipate over time as you get out of that active phase. That active phase can last anywhere from 6 to 18 months. And then once you're in the stable phase of Peyronie's disease, it is much less likely that you will see any change in curvature or any of those symptoms if you don't have treatment. That pain does go away, which can be a big bother for people who have it to start with, but at the same time, the curve and other changes can also be bothersome. In the end though, treatment is 100% based on patient bother. So from a medical standpoint, I never sit in the office telling guys you have to do something about it. I see a lot of people who come in concerned about a lump or a bump in their penis and they want to make sure that it's not cancer, which is very understandable. And so we talk through, again, this is scar tissue. It can lead to changes with shape of your erections. It may lead to changes in function of the erections too. And so again, that's why we want to treat erections and trying to increase blood flow. But if you have curvature and you aren't bothered by it, then you don't have to do anything to treat that. If you are bothered by it, then we do have several treatment options. We usually evaluate things in the office with an ultrasound to get some more objective data and then talk you through those results and treatment options based on that. That can range anywhere from like at-home traction therapy to in-office injections and some possible surgical options as well. Again, all of this is based on patient bother and what you're interested in as far as treatment is concerned. But if you are bothered by it, there are treatment options that exist, so I would definitely encourage you to see a specialist in this realm. I saw a patient and his wife recently who had seen a couple other providers before coming to my office, and unfortunately they had been told a couple times, you know, there's nothing to do about this, you just have to live with it. And he's bothered by it. He would really like to do something about it. And there are these treatment options. So I would just encourage you to, find somebody who has a lot of experience in this realm and is able to talk you through those viable treatment options. So this is just some general information about Peyronie's disease. We will delve further into this topic in a later video, as well as those specific treatment options. So I would encourage you to like, subscribe, and share, and we'll see you next time.